Healthcare workers have been significantly impacted by COVID. There was one provider in particular. Her name was Dr. Lorna Bren, the ER director at New York Presbyterian. And she would work long hours along with her colleagues, serving those who had COVID. I believe she actually contracted COVID herself. Patients were passing away at devastating levels. Dr. Lorna Bren took her own life. And she was one of 400 physicians who commit suicide each year because of so many reasons, but one of which is mental health access. Everything that we do in healthcare, it's all for our patients, but what about the staff?
When COVID hit, there were really hard days and difficult nights. I started to see burned out. I was burned out. Who wasn't?
Pues tuvimos una reunión y ahí es que anuncian el grant, ¿verdad? Este grant de HERSA para el burnout y que surgió de la necesidad a través de la pandemia. La administración de los Estados Unidos quería aliviar el burnout de los empleados que trabajaron en el campo de la salud. En este caso, las enfermeras, enfermeros, doctores, trabajadores sociales en el campo.
So when this grant came, I remember reading it and saying, why not? It was clear that La Casa de Salud, the primary care arm of Acacia Network, was the best positioned organization to carry the grant. We wrote it. A couple of months later, we got the award, and then the work really started.
So in 2022, we were awarded nearly $3 million. The goal was to try to mitigate burnout and improve resiliency amongst 20% of our healthcare workers.
We needed to do this not only for the Bronx, but also for the Puerto Rican workers that we had already met and that we knew were in such a need of this type of services.
Fuimos desarrollándolo con un equipo de trabajo en Puerto Rico, todas estas clínicas y todos estos grupos que trabajamos y que todavía estamos trabajando.
We were able to hire social workers, psychiatrists, mental health professionals that were entirely staff-facing, which has never been done.
I found dedicated staff who cared deeply about the patients, but yet experiencing an overload.
Hay falta de personal y una persona que atiende, ¿verdad? Unos pacientes pues, se duplican o se triplican porque no hay personal.
Many of the symptoms of burnout lead to depression and anxiety and emotional exhaustion.
¿Cómo vamos a entrar a esa olla de presión que está ahí por explotar?
I remember walking into Acacia and realizing the resiliency that our workforce had.
We have devout staff who care deeply for our community. If their cup isn't full, if they're not able to provide at the highest level of care, then what happens next?
¿No? Y quién sabe a dónde estarían estas personas, porque la quemazón lleva a la depresión, a la ansiedad y muchas veces al suicidio.
We've been able to reach over 2,800 employees across New York and across Puerto Rico. That's nearly 50% of our workforce who said at some point, I need help, I'm feeling burnt out, I'm feeling stressed.
We had staff members approach me and say, hey, I think I really am experiencing those symptoms. I need help.
They could have one-on-one time with our social workers or a psychiatrist.
I can think of one particular staff member who came to me. She was experiencing panic attacks. She learned how to do mindfulness breathing. And she eventually signed up for the free Headspace that the HRSA grant offered, which is a meditation app. She was able to click on the app, do a quick 3-minute breathing exercise, and eventually she was successful in managing her anxiety.
Acuérdate que venían ya no quemados por el COVID, venían quemados por los huracanes, los terremotos y le cae la pandemia.
Think about it. In the Bronx and in Puerto Rico, two highly impacted areas.
We also did a number of workshops for both leadership and for staff.
Hubimos talleres dinámicos que fuimos al mar y allá en el centro del mar, en un catamarán, se dio un taller para que tuvieran esa conexión.
I also brought to each of the La Casa de Salud clinics lunchtime activities where they can practice these stress management techniques.
ellos se abrían y dejaban atrás el trabajo. Muchas veces terminábamos todos llorando o riéndonos.
We've created performance improvement teams at all of our sites where we're inviting our staff to talk to us about what are those workflow issues that you're dealing with.
Let's talk about how we can bring down those stress levels.
Que nos dijeran a ellos mismos nos dijeran qué estaba pasando, cuáles eran las necesidades, a dónde debíamos ir, cómo hacerlo para que así fuese algo que venía de ellos.
So it's not just this top-down leadership, it's really from the staff, by the staff, for the staff.
It takes a while to figure out, where can I find a psychotherapist? How much is my copay? So to have this mental health treatment available, sort of on demand, it's paramount to preventing future occurrences.
We were able to see tremendous results. 50% reduction in depression, 53% reduction in anxiety, and nearly 52% reduction in burnout. That's astounding.
El programa creció para satisfacción de todos nosotros, para alegría de todos nosotros. Queremos seguir.
Having a program like this in-house is utterly important.
Absenteeism has gone down, morale has certainly gone up. Not only is this program working, but that there was such an unmet need through this that we're finally tapping into.
I never thought that this was going to be a program that would help me so much.
Me ayudó muchísimo a manejar el estrés, también me ayudó mucho a cómo yo lidiar con situaciones difíciles con mis compañeros de trabajo.
It really has helped me to understand my own purpose, my own feelings, and everything that was happening to me.
Siempre en las reuniones con GERSA, pues nos los comunican, nos dicen, mira, Acacia lo hace bien.
The strength of what we had in the Bronx and the strength of what was happening in Puerto Rico came together.
What makes me the proudest is the change that I see in the culture. Staff are more open to talking about mental health issues without any sense of stigma.
That was one of the main barriers that we really had to overcome, letting everyone know that it's okay.
And interventions like this that allow you to openly say to your staff or to your supervisor, I need help, I'm burned out. For us to be able to make that part of our culture meant the world to me.
Helping the staff sort of has a trickle-down effect to helping the patients.
In order for any healthcare worker to be able to provide the necessary services to their clients, they themselves have to be well.
Con una esperanza tan y tan grande, como ellos nos hablaran, los mismos empleados, de darnos las gracias de que por fin alguien se estaba encargando de ellos.
This program has been incredibly successful.
You get patients who want to come back because the staff is calm and not stressed out.
We are our community and our community is us.
When I walked in empty, I feel so full now of joy.
Para mí fue una experiencia inolvidable.
Gracias, Acacia, por darnos esta oportunidad, por salvar la vida de tantos seres humanos en Puerto Rico a través de este programa.